In tonight's Health Alert, mpox cases are climbing across the nation, and Michigan's numbers are rising as well.
Yeah, health officials are stressing the need for awareness to prevent a potential surge as summer travel and social events start picking up. So here to explain more is our chief health editor, Dr. Partha Nandi. And Dr. Nandi, how many cases are we talking about in Michigan, and what do we know about them so far?
Yes, so Glenda, since February, there have been about 16 probable or confirmed cases of mpox, formerly known as monkeypox. According to the latest update from the Michigan Department of Health and Human Services, cases were reported in Detroit and Oakland, Macomb, Kent, Genesee, and Ottawa counties. All the cases were men between the ages of 21 and 43. 9 were African American, and of the 16 cases, 3 required hospitalization. So mpox is a disease caused by an infection with the mpox virus, and infected folks can become extremely sick. Symptoms include fever, body aches, headaches, chills, fatigue, sore throat, nasal congestion, and a cough. However, the most common symptom, Glenn, is a rash in the body. It can start off looking like pimples or blisters and then develop into scabs before healing. It can be painful, itchy, and leave behind debilitating scarring.
Yeah, so how do these numbers compare to other years, and how do we prevent getting it?
Yeah, important question, right? So Michigan reported 4 cases last year compared to 394 the year before. Now, this year's numbers are still significantly lower than our peak numbers back in 2022. However, it's important to note that those cases primarily occur during the summer and fall seasons, and that's why health officials are concerned and working to curb any potential spread. As for prevention, we have a very effective vaccine that's important. It requires 2 doses, 4 weeks apart, and getting both are important because the majority of reported mpox cases are either in the unvaccinated or those who only got 1 dose. Now, anyone can get mpox. However, not everyone needs to get vaccinated. Men who have sexual contact with other men are considered high risk, and individuals who are HIV positive face a higher risk of severe outcomes, including death. Other ways to prevent mpox include avoiding close contact, such as kissing, hugging, and skin-to-skin contact with individuals presenting with rash symptoms resembling mpox. So I think we can do a lot to prevent it. It's getting the awareness out that this is not a disease that you can't prevent, but there are things you can do to prevent it.
All right. Different characteristics there too, Doc. Yeah.
Absolutely, absolutely.
Thank you so much.
My pleasure.
Okay. If you have a health question for the good doctor, you can email him, Dr. Nandi at AskDrNandi.com. Send it to us on Facebook or Twitter, and we'll get it right to him.